Good morning, everyone. Welcome to Labor and Health. Let's see, who's been to this committee before this year? Director, what's the first rule of thumb to remember? If you've got your cell phones, please turn them on, because if a phone goes off during the meeting, you buy donuts. We only have one more meeting left after this, so it's your last chance to buy donuts for the committee. Secondly, this is the last of our bills. This will be the final bill that this committee hears for this session. It's not a controversial bill, but a fairly popular one, receives lots of comment. We may end up at the point where we're limiting the amount of time you spend on comment today, just so we can get everyone in. It's not to be mean, although I am quite mean, but we do want everybody to have a chance to participate. Today, we're going to hear House Bill 4, Medicaid 12-month postpartum coverage. We'll forego a roll. We're missing Senator Bouchard, who's up presenting in appropriations this morning. Everyone else is here. So with that in mind, let's bring the Department of Health up if we could, and we'll let you just walk through the bill for us real quick. It's a committee bill, and you guys probably know it better than anyone. You've seen it once or twice.
Mr. Chairman.
Go ahead, sir.
Mr. Chairman, just for the members of the audience, so several of us have bills in other committees, so we'll maintain a quorum, but we'll be coming in and out during this. Thank you, Mr. Chairman.
Don't be personally offended. They're not leaving because of anything you say. Okay, welcome, Department of Health Director. Go ahead, sir. Kick it off.
Good morning, Mr. Chairman, members of the committee. Stefan Johansson with the Department of Health. As you mentioned, this was a committee bill from the last interim period. Provide a little bit of background and then a relatively straightforward and simple bill. Happy to explain it to you in a bit more detail. The background on this, Mr. Chairman and members of the committee, is from the ARPA legislation. There was a provision put into the federal law that allowed states to extend postpartum coverage in Medicaid for the pregnant women category for a 12-month period. Wyoming's current postpartum coverage in Medicaid for the individuals that qualify for that program is currently 60 days. As I mentioned, the ARPA legislation is what changed the ability for states to extend this coverage. And I want to be clear that states have always had the ability to extend postpartum coverage in the pregnant women category, but through waiver mechanisms. So this committee is familiar with Section 1115 waivers, other types of waivers where you have to go through a federal approval process, generally demonstrate budget neutrality to the federal government, a few provisions that are normally part of what we call Medicaid waivers. The ARPA provision that led to the committee wanting to draft this bill allows states to extend the postpartum coverage to a 12-month period without the use of a waiver, instead going through a state plan amendment process, which does not require the same strings and bells and whistles that I mentioned before. So it's basically a state plan amendment that would extend the coverage for the pregnant women category from 60 days postpartum to 12 months. Mr. Chairman, members of the committee, that's really it in a nutshell. The Joint Labor Committee during the last interim asked the department to come present during the summer on that option that came from the ARPA legislation and what it would cost and what we project the enrollment to be. That's basically what you see in the fiscal note for this. We anticipate that extending this coverage would cost the state approximately $3.8 million of state general funds for a biennium. So as this committee knows, and you are well aware, we have a 50-50 match rate in our Medicaid program, generally speaking. And so that's what we anticipate that this would cost, with an estimated enrollment increase on a monthly basis, given that coverage extension of about 1,250 individuals. It's important to note, Mr. Chairman and members of the committee, that as you know, we see significant churn in Medicaid. And so people come on and off the roles of eligibility, whether they lose eligibility for financial reasons, move out of state, et cetera. And so we've done that analysis to really look in a post-pandemic framework what that enrollment and thus what the cost would look like. The reason I bring that up, Mr. Chairman, is because part of the reason that we have what I would say is a very good projection and estimate of enrollment and cost here is because during the federal public health emergency, which is still ongoing. I believe the federal government is set to expire that in May of this year. But for the past 2.5 years or so, state Medicaid programs, by nature of receiving an enhanced match during the pandemic, an enhanced federal match, have been unable to disenroll Medicaid members for not losing eligibility. That has allowed us a natural experiment to study this group. If Wyoming were to extend this coverage, what would enrollment look like? What would cost look like in a better framework than we might have been able to do without that sort of natural experiment, since we've been unable to disenroll Medicaid members for the past 2.5 years or so. As a side note, I would mention many states have seen increased utilization and costs by nature of that federal provision during the pandemic not to disenroll. Wyoming's kind of unique in this regard that we really haven't. We have in certain pockets of the Medicaid population during the pandemic, but really our utilization and those costs have been somewhat flat, even with that inability to disenroll folks, which has led to some budget offsets and savings, which you all in the legislature have rightly used to fund other priorities in the Department of Health. So with that, Mr. Chairman, just very briefly walk through the bill. Page 1 really just sets up the title. Going to page 2, in section 2 and 3, you can see really the direction to pursue the postpartum coverage extension. In section 3 at the bottom of page 2, you'll see there's appropriated $1.9 million from the general fund and $1.9 million federal funds. That gets us to the $3.8 million figure that I mentioned. I will note that on the subsequent page, on page 3, this bill does contemplate basically a temporary authorization for this coverage extension, with the direction for us to come back and request these funds in our standard budget. Part of the reason for that is Chairman Baldwin and Senator Hutchings, you might remember from the interim discussion, in the original ARPA legislation, there was not a sunset provision. There was a 5-year period that the federal legislation allowed for this coverage extension to 2027. And that the federal government does that often. We'll do this for 5 years and then reevaluate depending on states that use it, what we see in terms of the population enrolled, et cetera. That 5-year period that has essentially gone away in between the ARPA legislation passing and now. So there's no longer a sunset on the federal level there, but there was a lot of discussion during the interim about should we do this in that 5-year period in Wyoming if this were authorized, or should we make it permanent? So you'll see that in page 3 of this bill, really directing some additional discussion if this coverage extension were to pass, that the department would come back and request these funds in our budget. And obviously during the interim period, I think we would certainly have discussions with this committee and likely appropriations on what those needs would be. With that, Mr. Chairman, that's really the bill. I did want to mention, since there was some discussion in the other chamber on the House side, maybe preemptively answer some questions that I've been asked about what programs do we already have that would support this population. And there's been some discussion that there's a lot of programs in the Department of Health that already provide this coverage. And just to clarify, the only kind of substitute that you would see for this population that would mirror the kind of coverage that we're talking about in Medicaid would be when the pregnant women eligibility group does qualify for another Medicaid program. Typically what we see, Mr. Chairman, members of the committee, is in a postpartum coverage period, it's not all of them because the eligibility income limits are quite low, but some of our pregnant women category will end up qualifying for our family care adult category. So you give birth and now they're a caretaker. That category of Medicaid eligibility is 56% of the federal poverty level and below, so very low income, and caretaker. So you're either a parent or have a ward, someone in your custody, and that can qualify you for another Medicaid eligibility group. We call it the family care adult group. That would give you the same coverage, same Medicaid coverage as the pregnant women or postpartum category. But in terms of other programs in the Department of Health, I would say that the comprehensive insurance that Medicaid provides, it's not a one-to-one. So there was discussion, don't we have mental health support for the general population? The answer is yes. Our community mental health centers do offer, mental health supports kind of on a general access basis. And there's a variety of programs that offer some services to populations depending on their income. But I just wanted to clarify for the committee that when we talk about Medicaid coverage, basically insurance, much of that is not one-to-one unless you already qualify or subsequently qualify for another Medicaid program. So wanted to address that, maybe preemptively answer that question, Mr. Chairman. And with that, have two very smart individuals to my right. If you have more questions about the details, the data, enrollment, costs, but Mr. Chairman, happy to stand for questions. I will mention in closing, again, this was a committee bill. I've tried to be clear that this is a policy decision for the legislature. We can certainly discuss the pros and cons, the impacts and the benefits, but we tried to give you the best data that we can, our best estimates, but ultimately this is a policy decision whether or not the state of Wyoming should extend our current postpartum coverage category from 60 days to 12 months. And with that, Mr. Chairman, happy to stand for any questions.
Very good. Questions for the director, Senator Dockstader.
Thank you, Mr. Chairman. Director, when you say family care, is that the same thing that's called a family caregiver program? And I got that information I got on that is it's 10,000 or less they make a year. That's how low the threshold is.
Mr.
We're talking one
Chairman,
and the
Senator
same thing.
Dockstader, yes, I think terms are probably interchangeable. As a reminder to the committee, in Wyoming Medicaid, you cannot qualify for Medicaid simply by being low income. Since we're not a Medicaid expansion state, it's generally being low income and meeting a categorical eligibility condition. In this case, the low income family caretaker eligibility group, as I mentioned, is about 56% of the federal poverty level. Currently, for an individual, I believe an annual income there would be about $7,000 a year. For a family of four, it scales up, and we can certainly provide the most recent data there.
Mr. Chairman, one other.
Go ahead.
Director, the only other is I'm asking what other programs are, because I was reading some of the discussions from last week and they said 29 programs. I'm down to just the family care and possibly the family planning waiver, which is all about reproductive health and all that, which really doesn't fit into any of this. So we're down just that for possibilities, right?
Mr. Chairman, Senator Dockstader, for Medicaid programs, yes, I think it's narrow in terms of potential eligibility that this group articulated in this bill may be the overlap of what some of that population might be eligible for. It might be helpful for the committee to know our current pregnant women eligibility threshold is 154% of the federal poverty level. That's not contemplated to change. This is the same group. We don't expand through this bill. Eligibility is not expanded. The time that you're covered is expanded. So Senator Dockstader, I think what we're talking about here, and hopefully I'm answering your question, is there are certain eligibility groups in Medicaid that might have overlap. You might qualify for one program and then subsequently qualify for another. But given that the pregnant women threshold is 154% of the poverty level, so a little bit higher, quite a bit higher than the family caretaker threshold, which is 56% of the poverty level, not all of those pregnant women will qualify for the other coverage groups in Medicaid. To answer your question directly, I heard the same discussion about 29 programs in the Department of Health that provide this coverage. And just to be clear, again, there are programs in the Department of Health in the state and other agencies too that may have services that this population could qualify for. But in terms of providing the health insurance, the comprehensive coverage, it's not one-to-one. And so, again, I think a good example is we do have community mental health and substance abuse centers around the state that provide services on a sliding fee scale, don't turn folks away for an inability to pay. But those, again, we're talking apples and oranges here. One is the ability to receive services in a very targeted type of service, and one is really a health insurance program that we're talking about. So I don't think, Senator Doxeter, that it's one-to-one.
Right, correct. And one more.
Go ahead.
You noted we're not a Medicaid expansion state. That has never been approved. It's failed in vote numerous times. And I've always been opposed to it. What we have here is not, the way I see it, not Medicaid expansion. It's an extension of an existing program, right?
Go ahead, Director.
Mr. Chairman, Senator Doxeter, correct. This is a time extension on a current eligibility group. So no change in eligibility or a growth in the population other than instead of being covered for a 60-day period, an individual in this group would be eligible for a 12-month period.
Thank you.
Further questions, committee? Senator Hutchings.
Thank you, Mr. Chair. And Director, you know how I feel. I've not tried to hide in any way my feelings on expanding, extending coverage when I think people should learn to be responsible for their own healthcare needs and so on and so forth. But I wanted to just clarify some of the things you said, just so I have them straight in my mind. When we're talking about this coverage, we're not talking about adding new members to the rolls. So if there are 5 women that are now getting coverage, we're saying we're going to extend that coverage for those 5 women. But what do you mean by the enrollment figures going up to 1,500? That's my first question, if I may, Mr. Chair.
Go ahead, Director.
Mr. Chairman, Senator Hutchings, it's a good question. So like any insurance plan or coverage, we think in those terms that when we cost something out or look at how many people we will be covering on a monthly basis, we look at that on kind of a rolling average or a monthly average. So you're absolutely right to answer directly. The population that would be eligible for this program and the eligibility threshold financially does not change. When I say enrollment increase or cost increase, it's really because since we currently have a 60-day coverage period, and if this passed, we would be extending that to 12 months, we analyze that and project that out on a monthly basis and say, okay, now in the pregnant women category, since we've extended that coverage, on a monthly basis, we will see an increased quote unquote enrollment of that group by X, and we believe that's 1,250. That doesn't mean that, again, it's struggling for the best way to articulate this, that it's an expanded coverage group. It just means that on a monthly basis, we'll see more people in that program because we've extended the time that they're eligible, if that makes sense, Senator Hutchings.
Yeah. Thank you. Another question. I don't look at Medicaid as insurance. I look at it as full-blown welfare. You're just giving people money, services, no skin in the game. They're just getting this benefit for really nothing, just by virtue of being pregnant. And I hear the word insurance. Can you help me with that?
Director.
Mr. Chairman, Senator Hutchings, I certainly consider Medicaid an insurance product. It's a public health insurance product. And you're right, it's very different than a private commercial product where there's more significant premiums and cost sharing. We do have cost sharing in Medicaid, but it's relatively de minimis for the groups that we cover or insure. But I certainly consider it health insurance because we cover a broad array of services that folks would have access to, like an insurance plan. Now, how you qualify for insurance is different in the public or private sector. So on the Medicare side, reaching age 65 and, paying into that system for your life qualifies you for that public insurance. With certain amounts of premiums and cost sharing. On the Medicaid side, in Wyoming, it's income and categorical conditions, so various disabilities, things of that nature that qualify you for public insurance. But Senator Hutchings, I think, I don't think we're on different pages here. I consider our Medicaid program to certainly be an insurance product with what we provide, but it looks very different than the private sector.
Thank you.
Okay. Senator Barlow, do you have something?
Thank you, Mr. Chairman. So Director, how long is the child covered? Thank you, Mr. Chairman.
Director.
Mr. Chairman, Senator Barlow, currently we have 12-month continuous coverage for the baby that's born on Medicaid.
Further questions, committee? One more, Senator Hutchins.
Yeah, one more. Thank you, Mr. Chair. Director, you have a program and it's called Pregnant by Choice. How much time and energy, effort, money is spent on that program?
Director.
Mr. Chairman, Senator Hutchings, I'll defer to Mr. Springer, who's to my right, for some of the details. That is a very small program. Again, it's one of our waiver programs that basically for folks that would be in that similar pregnant women category, it provides, I believe, one annual visit and some family planning services, things like birth control, that type of thing, but very, very different than what we call the state plan services, which we're talking about in this bill. It is a waiver program. But Jesse, I'm not sure if you know the current enrollment and cost. And that I know.
Let's do this, Jesse. Let's go ahead to both of these guys, and we'll hear from both of them, and then we'll take further questions if we have them. Go ahead.
Chairman Baldwin, Senator Hutchings. So the enrollment during the public health emergency of the family planning waiver is very, very low. So there's actually currently less than 20 people on the program per month, mainly because they've not left any other program, if that makes sense. So if you looked at that enrollment today, you'd say, what is this program? It's very small. But if you go back to the days before the public health emergency and we were disenrolling people from the family plan or from the pregnancy group or possibly from any other group, this is offered at 60 days. So when you're pregnant, you deliver. 60 days later, if you're in this pregnancy group, you're losing eligibility at that moment. Currently, by the way this program is structured, the family planning waiver, you're offered the family planning waiver, and only at that moment. So you can't come back later. You can't have family planning services before pregnancy. So that it really just at that 60-day moment, you're offered the family planning waiver, and that package is extremely limited. So the diagnosis codes have to be related to family planning. The procedure codes have to be related to family planning. The providers that are offered are only family planning. The pharmacy package is a very, very limited pharmacy package. So the actual costs of that program are very, very low. So last year, the costs of that program were less than $20,000. In the highest year, that program has never cost more than $100,000. So it's not a very big program because it is very limited. And in a lot of cases, people may have a better option than that family planning waiver. They may have qualify for marketplace coverage, and that would be much better for them to go get a subsidized plan on the marketplace that has a full medical plan. But for individuals that are under 100% of the poverty level, that would probably be a good option for them because there would be no other way for them to get family planning services. That's something they were looking for.
Very good. Anything else you want to add? Go ahead and add it now, and we'll let Franz add anything he wants to add, and he's shaking his head no.
I'm just here for questions, so thank you, sir.
Okay, questions for these two committee? Senator Hutchins, you got one finger up. I think that means a question.
Yeah, it does. Thank you, Mr. Chair. I appreciate that. Director or whoever wants to answer, on page 2, sections 2, we have pursuant to the authority granted by the section 9812 and 988 of the rescue plan. I went out and looked at it, and as you said, it allows us to do this. And my question is, why do we have to do it? What is pushing you forward to do this?
Director?
Mr. Chairman, Senator Hutchings, this is absolutely an option. Wyoming does not have to do this. And the Joint Labor Committee during the last interim passed a committee bill to authorize this. So the result of that discussion in the last interim was that the previous committee supported the coverage extension. Again, Senator Hutchings, we're here to provide the enrollment cost impacts, that information. Certainly don't want to put my thumb on the scale on what is absolutely a
Right.
policy option and a decision for the legislature.
Very good. Okay, let's,
Quick- quick-
go ahead. Make it quick, because we're
Yeah,
gonna run out of
it's
time.
really
Go ahead.
quick. Page 2 again, in that same section, it says the Department of Health shall apply. Is it possible that you guys may apply?
Director?
Mr. Chairman,
Thank you.
we wouldn't, if I'm hearing your question, Senator Hutchings, and tell me if I'm wrong, if this didn't pass, could we do this anyways? The answer to that is no. We would look for the legislative authority and the appropriation. That's when we do a state plan amendment. I think CMS would be looking for that legislative direction. If this language were changed to May, I'm not sure that really matters. This would be the legislature directing us to do this coverage.
Okay, thank you, gentlemen. Have a seat. I see no legislators in the room, and President Driscoll, anything you want to add to the discussion, President Driscoll? No, checking. Okay, agencies or departments in the room? Nobody jumping up. Okay, well, here's the situation. We've got about, yep, there's one from the governor's office. She was hiding back on one of the back rows. Welcome, Ms. Davis.
Good morning, Chairman and committee members. My name is Jen Davis. I am in the Governor's Office as the Health and Human Services Policy Advisor. And I'm here today to just speak on behalf of this bill. Governor Gordon, as a pro-life governor, believes that this is an avenue to ensure that we take care of women and infants, and making sure that the women have coverage that they need by extending this to 12 months allows women who may be struggling with physical ailments due to delivery past 6 weeks or any mental health issues. As we know, 6 weeks postpartum is when most visits happen for women who have just delivered. And very often that might be a time where maternal depression is diagnosed. And in that case, if they have the current coverage that we have now, that would only allow them a couple weeks of coverage to address that issue. And by extending this, we will allow these women not only physical care, but mental health care to help with any ailments that they might be suffering from that will make them a better mom, make them a better parent, and ultimately make our infants safer. So just wanted to share our perspective on this bill, and we'll stand for any questions.
Question, Senator Dockstader.
Thank you. We're sorting out this mental health and hopefully finding a solution for the state, so we get off of that horrible rating that we're at now. Do you see this, as we talk about mental health, do you see this as kind of part of that plan to improve things? Because I've seen both. This postpartum situation, I've seen it happen to people who have the money to pay for it. I've seen it happen to people and families who don't have the money to pay for it. I wish they would have had an avenue to pay for it. Do you think this fits into our overall mental health improvement plan?
Ms. Davis.
Chairman Baldwin, Senator Dockstader, we do see this as an avenue for helping access to mental health care for women postpartum period. As I mentioned, unfortunately, many women suffer from postpartum depression, and not treated can lead to further mental health issues. As we know, unfortunately, our suicide rate is very high here in Wyoming. And so we want to ensure that we're getting women that support that they need right away. And it's an unfortunate thing that happens during pregnancy. Hormonal imbalances are just part of the physiological response to pregnancy. And so by allowing that additional coverage so that that can be monitored and get them on a path to recovery for mental health, I do think this is an avenue to help support them over time. And giving them a year of coverage can definitely, hopefully, mitigate further need for additional mental health services.
Very good. Further questions? Go ahead, Senator Hutchins.
Thank you, Mr. Chair. Ms. Davis, I'm seeing in this committee, everything's being tied to suicide, everything. And I'm wondering, is there any data that we have out there that shows that these women are committing suicide, or that the expansion, the extension of this will indeed, if done in other states, prevent that? Thank you.
Ms. Davis.
Chairman Baldwin, Senator Hutchings, thank you for that question. I do not have any data with me. I will say that there might be some data out there that I can certainly look and see if we can find for you. I will say it increases the risk when we have untreated depression for suicide, whether that be in pregnant women, postpartum women, anybody. That is a risk factor. So by treating depression, we know that we can mitigate that risk for suicide. As far as numbers, I honestly don't know that, but that is definitely something that we could look up for you to see if there's that data.
Very good. And I suspect one or two of the people here may have some closer answer, but
Yeah.
that being the case. Thank you very much, Ms. Davis.
Thank you.
Okay, here's the plan. We got a little less than 45 minutes. We're going to allow for public comment. And then we're going to close public comment and move on. I've got a whole list here of better than a dozen people online, but being that you all braved the roads and are brave enough to be here and turn your cell phones on for me, you're going to be first. We're going to hear from the room first, but we got 4 chairs. So what I would like to do is on my right, your left, is people that support the bill. On my left, your right is people who oppose the bill. I would like to fill all 4 chairs. We're going to do a time limit of 2 minutes per testimony. So 4 people that want to jump up here. If we have nobody that's opposed or nobody that's supportive, fill the chairs. And rotate out after you testify. Please introduce yourselves. And you got 2 minutes to tell us what's on your mind. And those who are listening online, if you've heard it, if somebody else said it, you don't need to say again, say, I agree. And we'll keep things moving and everybody will get a chance. Go ahead, Mr. Hackman.
Good morning, Mr. Chairman, members of the committee, Dr. Hollis Hackman with the Wyoming Psychological Association. And since this is the last time you'll see me this session, I just want to say thanks to the committee for allowing us to speak. My membership is out there providing mental health care to the folks in the state, and it's hard for them to get here to speak. So I attempt to speak for the association and for those folks, and I'm thankful for that opportunity. Mr. Chairman, we rise in support of this bill. We provided testimony in the other chamber in regard to this bill. In full disclosure here, treating postpartum depression is not my area of expertise, but having talked with folks, providers that provide treatment to these folks, if untreated, postpartum depression can last for months, maybe longer. And so providing treatment to these folks is very important. Mr. Chairman, in an attempt to try to answer one of Senator Hutchings' questions, if you do a search on this and start looking up information and research that's been done in the Journal of the American Medical Association Psychiatry issue of 2021, it's described in terms of suicide attempts, it's described as having tripled in the last decade. This is a large national study, and I'm happy to give the reference to you, Senator Hutchings. Also, as related to suicide, we know from other research that 63% of suicides in postpartum women occur between day 43 and day 365. So that's outside of that 2-month period that's presently covered with our present legislation. So I just wanted to share that quick information and reiterate that we support this bill, and I'm happy to stand for any questions.
Questions for Dr. Hackman? Go ahead, Senator Hutchins.
Thank you, Mr. Chair. Dr. Hollis, really quickly, I'm hearing the words postpartum depression. That was just something that was brought up. How many women actually get that?
Mr. Chairman, Senator Hutchins, I don't have the prevalence rate in front of me, but I can get that information for you, absolutely.
Thank you.
Okay. Further questions, committee? Thank you very much. Next presenter, somebody else fill that chair. Go ahead, ma'am. Introduce yourself.
Thank you, Mr. Chairman and members of the committee. My name is Gwyneth Hargett. I'm a senior at Cheyenne Central High School, and I'm representing myself from Senate District 4, speaking in support of House Bill 4, Medicaid 12-month postpartum coverage. I have two key reasons that I urge your support on this bill. Firstly, this bill is financially necessary for postpartum women, but secondly, expansion of postpartum coverage will decrease postpartum health complications. So firstly, looking at those financial necessities, the Healthcare Cost Institute reported in May of 2020 on spending on behalf of birthing parents, and they found that 19% of overall postpartum spending was in the first 60 days. 9% was in 60 to 90 days, and 72% of postpartum spending occurred between 42 and 365 days. Now, the 70% of spending after 90 days equates to about $1,650. This is simply unfeasible for parents that are using Medicaid right now. The Wyoming Department of Health in 2023 reported that a pregnant woman can qualify for Medicaid with postpartum care if she is making less than $1,745 a month. The spending required for adequate postnatal care is approximately 95% of the maximum monthly salary a single individual on Medicaid can earn. There is absolutely no way that a mother can pay for housing, food, and the other essentials while also paying postpartum care. And as a result, her health will suffer. Secondly, expansion of postpartum coverage will decrease postpartum health complications. Problems that arise under postpartum do not simply end after an arbitrary 60-day limit provided under current systems. The mental health effects of pregnancy persist long after a child is born. To answer Senator Hutchins' question, the CDC in 2022 found that 1 in 8 women experience symptoms of postpartum depression, leading to a clear increase in suicide rates. Additionally, there is a diverse array of physical complications that occur in postpartum, including infection, hemorrhage, cardiovascular disease, etc. In fact, the CDC found that the leading cause of postpartum death after 42 days was cardiomyopathy, and that 61.9% of postpartum deaths between 42 and 365 days could have been prevented. And a lot of that has to do with continuity of care and access to care. It is far time that we abandon the idea that 1 or 2 postpartum doctor's visits is going to be enough. So, Mr. Chairman and members of the committee, I urge you all to support and empower women everywhere, and I will stand for questions.
Thank you very much for that testimony. I'm trying to take a breath with you.
Thank you.
Holy smoke. Question, Senator Hutchins.
Quinna.
Yeah,
Very
Gwyneth.
good,
Yeah.
Mr. Chairman, thank you. Very good job.
Thank you.
And I know it takes a lot to sit there in that chair and speak. Even for me, I get a little scared
Yeah.
to sit there. So thank you for your testimony. It was really well heard. Quick question. One of the things I'm seeing in society today is we think that the government should help us with everything that we need. Have you, as a student, thought of, wow, wouldn't it be great for us to get together and form a group of women, empowered women, that would want to spend their time, energy, and effort, and of course their finances, and help pay for those women who are in need with these type of issues? Thank you.
Go ahead.
Senator Hutchins and Mr. Chairman, thank you. I definitely think that there are groups out there that support women like that, such as Planned Parenthood. But ultimately, I think most people and most women on Medicaid aren't on Medicaid because they choose to be on Medicaid. They're on Medicaid because of their circumstances that have put them in that position.
Very good. I'm guessing this is not the first time you presented in committee.
This actually is. I'm just on the speech and debate team at my high school, so
I knew it. You won today. Good job.
thank you.
Okay, further questions, committee? Oh, very good. Go ahead and move on. Go ahead and introduce yourself.
Hi, Mr. Chairman and members of the committee. My name is Lily Lehman, and I'm a senior at Cheyenne Central High School. I'm representing myself as a resident of Senate District 4, and I'm speaking in support of House Bill 4, Medicaid 12-month postpartum coverage. The Mayo Clinic asserts that for mothers, untreated postpartum depression can last for months or longer, sometimes becoming an ongoing depressive disorder. Mothers may stop breastfeeding, have problems bonding with and caring for their infants, and be at an increased risk of suicide. Even when treated, postpartum depression increases a woman's risk of future episodes of major depression. Considering that these disorders and episodes can be ongoing and reoccurring, it is necessary that women have the proper support and healthcare to support the welfare of themselves and the welfare of their children. Mothers deserve the security and services to care for their health and in turn the health of their children. It is abundantly clear that women require Medicaid coverage beyond the 60-day status quo to adequately care for themselves, and through denying this right is a huge disservice to the thousands of mothers who have to grapple with not only the hardships of being a new parent, but do not have the financial means to support them. Now, there are some debate whether or not the government should be involved in healthcare, and this is worthy debate to be had, but we should ask ourselves about our intent whenever the question is raised. Do we really intend to call into question all government involvement in healthcare? Do we really mean to signal to every person who receives healthcare through Medicaid or Medicare that their access to a curable illness should be questioned? Do we mean to tell our veterans that their access to healthcare should be questioned? Or do we only raise the debate to distract us from the current question of whether or not the working poor who make just a little too much to qualify for Medicaid but still cannot afford health insurance? It is also important to distinguish having access to healthcare from welfare. Wyoming women are independent and tough. The last thing we want to do is spend our free time in a doctor's office. The concern that this reasonable extension will result in a flood of women overwhelming doctor's office needs to be taken into account, but we need to understand that that reality is simply unfeasible. Now, Mr. Chairman and members of the committee, thank you for your consideration and for the service to the people of Wyoming. I will stand for any questions.
Thank you thank you very much. See, you got me, I can't breathe. You high school students are killing me here. Very good. Any questions? No questions. Thank you very, is this your first time appearing in a committee?
Yeah.
You did very well. Congratulations. Thank you very much. Okay, we're gonna have 2 empty seats. I know there's other people up here. I'm guessing that these old people won't talk that fast, but go ahead and introduce yourself.
Thank you, Mr. Chairman, members of the committee. Josh Hannes with the Wyoming Hospital Association. I won't be nearly as articulate as the 2 previous presenters, but just a couple of comments. So the Hospital Association, our members are certainly in support of this bill, and what's become a common refrain for me in front of this committee is that insurance coverage like this provides appropriate access to care to drive patients hopefully away from the hospital setting to the extent possible, and avoiding those expensive ER visits that often go uncompensated. And particularly for a woman who's just given birth to a baby at a critical time in their life, being able to manage, say, if they've discovered they now have a chronic disease so that they can afford medication, be able to manage that disease with their primary care provider, and then hopefully within that 12 months be able to transition to a different pay source. So perhaps that's moving into the marketplace, or how most people get their insurance in Wyoming is through their employer. So these women at the appropriate time can return to work if their employer provides insurance, hopefully be able to move them to that pay source. We think this is good policy. We think this helps women at a critical time, and we'd encourage an aye vote. And I'd stand for questions.
My name is Rebecca Hazelton. I'm the director of the Wyoming Women's Foundation at the Wyoming Community Foundation. And Mr. Chairman, members of the committee, we support this bill because of what it would do for moms. And our mission is to help women achieve economic self-sufficiency. And we believe that this would help moms that are working. And so a lot of moms that are living below 154% of the poverty level don't necessarily have access to other health insurance, as was testified earlier. And a lot of them are working, and the types of jobs that they're working in, retail, childcare, food service, don't offer health insurance. So we consider this to be a work support. About 36% of moms are single moms are living below the poverty level. They also don't have access to a husband's health insurance plan. So there's just no way for them to get insurance through an employer. We just really feel like this provides a bridge to self-sufficiency. I wanted to address a question about how many folks that this might serve, and just had a little bit of data to share that's available in the Wyoming Kids Count Data Book from 2022. And that is that about 561 moms made claims between 60 days and 12 months postpartum for mental health claims on this, the temporary extension plan. And so that's just a kind of a number that you can look at as to how, what the need is for this, when there were about 2,000 enrolled at that time. So that was just a statistic I wanted to offer you. Thank you.
Your group.
Go ahead.
Mr. Chairman, Senator Hutchings, I'm with the Wyoming Women's Foundation.
Senator
right.
Hutchins, did you get this handout?
Yeah.
That's who it's from.
Okay, great. Thank you, Mr. Chair. Mrs. Hazelton, quick question. You said you want women to be self-sufficient. Of course, you know, I look at this as a way to make them more dependent on government. But with that said, with the group that you're in, like other groups out there, like Climb and Life Choice, they depend on donations from citizens to help them with their programs. Again, is it possible that your group or a group like yours could start up a program where women are helping other women with these types of with this type of insurance instead of depending on the government for it? Thank you.
Go ahead.
Mr. Chairman, Senator Hutchings, philanthropy absolutely has a role in helping our neighbors. And I think the Wyoming Community Foundation, the Wyoming Women's Foundation does do a good job with that. And we invest in nonprofits all around the state that are helping women and girls move towards economic self-sufficiency. And there's also a role for policy to support those programs so that women and girls have the supports that they need to get to that point in their lives.
Very good. Further questions? Thank you very much for coming. Okay, you guys flipped a coin there. Go ahead. Go ahead and introduce yourselves.
Good morning, Chairman Baldwin, members of the committee. My name is Erin McKinney, and I work at the Cheyenne Regional Medical Center. I'm the clinical director for Women and Children's Services. I've been there for 22 years, so my entire experience in my professional career has been in women and children's health. So I'm here today to take on maybe a different perspective and focusing on maternal mental health, but the impacts that it has to the baby's development. The impact in the research is significant on how babies respond emotionally as we know that the first year of their life is a critical part. We know that there's the baby blues that resolve within the first few weeks, but postpartum depression can last much longer, affecting the mother's day-to-day life. There's a strong correlation that the attachment relationship between mom and baby. It's important to note that interventions with therapy, medications, and treatments greatly improve the relationship. When an infant's mother is depressed, the relationship is compounded by suffering with both mom and baby. The barriers to women receiving mental health care can be lack of healthcare coverage. Depressive mothers often experience more stress, perceive their children in a more negative way, and might think their baby is not attached to them or that their baby likes them. Some mothers have lowered maternal instinct and have hostility and aggression towards their baby. They may even feel that their baby has rejected them. Consequences of untreated postpartum depression impacts 2 generations, not just the mother. A mother might not acknowledge her baby's cues, and her baby begins demanding mom's attention and will go through every measure that they can get it. Research and observations of moms who are depressed with their engaging with their babies is high to show the emotional disconnection. When a mother leaves a room and returns, their baby resists efforts to communicate when she returns. They may go towards the mother, but they don't look at her. They look at the wall instead of the mother's face. When women are non-responsive to excessive crying or give up, thinking that the mother herself is being unsuccessful, moms appeared indifferent and babies cried more. When a mother has postpartum depression, her baby's emotional recognition is impacted. Babies that are positively responded to have better social behavior and adjustment. On the other hand, moms with untreated postpartum depression increase negative outcomes for their children. And to go into those, there are delayed cognitive and language. Infants whose mothers were more depressed at 3 months postpartum had an impacted attachment style 15 months later, despite the mother no longer having depressive symptoms. When a baby is placed in the arms of a stranger, children with mothers having postpartum depression had significant lower responses of distress, more likely because of avoidant attachment.
10 seconds.
At 9 months, infants of depressed mothers have less social engagement, moving on as they're getting older, ADHD, depression, anxiety. So I think what's really important is that impacts it also in their teen lives. And like I said before, this impacts 2 generations. And I'll say in this room, my dad is here. I had postpartum depression. So my kids, so for us, it's 3 generations.
Thank you very much for that testimony. I believe Senator Doxer had a question.
Would you send me a copy of your notes to that legislative website?
What's that?
Send me a copy of your notes. You didn't get to say, tell us everything. Send me the full copy, would you?
And for what it's worth, everybody in the Senate, probably in the House as well, reads their email constantly. So anything that doesn't get heard here, please send to us. That's a good point. Okay, go ahead and introduce yourself, ma'am.
Okay. Mr. Chairman and members of the committee, my name is Megan Schuster. I am a NICU nurse at Cheyenne Regional Medical Center, and I would like to share a personal story focusing on Kanan, my now 2-year-old, and my own experience with postpartum depression. Kanan was born in September of 2020. My immediate postpartum course was uneventful. 12 weeks later, I was back to work. Most of my coworkers probably told you I was handling everything great, but this is what my life actually looked like. Most evenings, I would lock myself in the bathroom and stare at my insulin pump for a while. I'm a type 1 diabetic diagnosed as a teenager, and I would sit there and contemplate how much insulin I should take to quickly and effectively end my own life. And then I would think of my older son, Finn. He was 2.5 at the time, and I would think, how in the world would he understand if mommy suddenly wasn't there anymore? And it was that thought and that thought alone that made me put down the pump, unlock the bathroom, get back to life. But it became harder and harder to convince myself that I needed to live. I felt that my kids would be far better off without me. Kanan was just a baby. He wouldn't even remember me anyway. And my husband and mom would take care of my oldest far better than I was capable of, I thought. And there were other thoughts that I had. With my first baby, the thought of SIDS terrified me, but this time around was different. I had these thoughts that if Kanan died from SIDS, it wouldn't be such a bad thing. In fact, it would probably be best for everyone. And then maybe I would finally get some sleep. Sleep was strange too, because I wouldn't just be asleep, I'd be comatose. And when Kanan cried in the night, I couldn't physically get out of bed. And thank God for my husband, who would get up in the night and give the baby some formula. And I'm just thankful he was there, because I can't say for certain if I ever would have gotten out of bed to feed him, to care for and comfort my own baby. And I wonder if he would have laid there alone all night, and I wonder if he would eventually lost weight, fallen off his growth curve, and they would have called me an unfit mother. And it felt like the motherhood part of me that was supposed to be innate was somehow broken or defective. And there were thoughts that scared me sometimes, thoughts that prompted me to tell my husband and my mom, do not leave me alone with my kids. I couldn't bring myself to tell them why, other than saying that I was completely overwhelmed and I couldn't handle it. There were a lot of things like this, more than I can tell you in this short period of time, but even with my background as a NICU nurse, it wasn't until I took Kanan to his 4-month well child appointment that I was able to see how bad the situation was. It's not easy to tell someone that you almost killed yourself last night and the night before that. It's way easier to fake it and pretend like you're doing fine. My story ended well. It took a while to get my appointment scheduled because the mental health resources in the area were extremely saturated. It was difficult for me to even call a secretary. How do you explain that you want to die and you don't care if your baby dies either? And how do you ask for help when you think you're crazy and when you think you aren't worth saving anyway? So over the next few months, I had frequent visits with a therapist and a psychiatrist, but postpartum depression isn't a quick, easy fix. It's not a here's a prescription for Zoloft and now your life is perfect. It's months of adjusting and that and therapy. And I would also like to just specifically emphasize that none of this hit me until 3 to 6 months postpartum. So after that initial 6-week period. And if I hadn't had the resources and the ability to get the help I needed, I don't know that my outcome wouldn't have ended in a tragedy either for me or for my children. And I'm grateful that I had a supportive family and that I had health benefits so that treatment was within my realm of possibility. And finally, I'd just like to show you the reasons that I'm here. These are my boys, they are everything, and sometimes I think to myself, how do I tell Finn, my oldest, that he was literally my salvation, that because of him, I talked myself out of suicide nearly every day, and that is a responsibility no 2 to 3-year-old should carry. And how do I tell Kanan, my trusting, independent, chaotically sweet toddler, that it wasn't his fault? It was never his fault. And no matter what sort of thoughts I had at the time, I'm so grateful for his presence in my life, and I know that it wasn't my fault either, that hormones and brain chemistry are beyond our conscious control. But I remember the thoughts and it still hurts. And I'm here because I know that women deserve postpartum care and that babies deserve mothers who are mentally able to care for them. For this, I am in favor of extending Medicaid to 12 months postpartum in order to make sure that moms who develop postpartum depression in their first year don't slip through the cracks and their children don't suffer the consequences. Thank you for your time.
Thank you very much. Now you talked very fast at the end. That was very good. Thank you very much for coming. Any questions, committee? Thank you very much for appearing. Okay, did you guys arm wrestle? You did, and you won. Go ahead, ma'am.
Thank you, Mr. Chairman. Kathleen Peterson here. I apologize for my attire. I have a physical therapy appointment. It's right after I get through speaking. I cannot say as eloquently as these young women have said the need for this bill to go through. I used to work in family services. I used to do child abuse investigations. I can tell you that the bill that is in front of you is addressing poor women. Poor women. It's not middle-class women. It's not women who have resources. These women usually are isolated. They don't have the support. They need something that helps them through this time period. I worry about the children because that used to be my focus as much as the mother, and I really hope that you pass this bill, and I stand for questions.
Thank you very much. Shortest testimony yet. We appreciate you.
And I couldn't speak as fast as
I
they
believe Senator
either.
Hutchins has a question for you.
Thank you, Mr. Chair. Thank you, Kathleen. I've asked this question a couple times and I haven't received an answer just yet. I know that you're in women's groups and there's a lot of you. I've seen you around a lot. We kind of know each other.
Yeah.
The question is, with all the women out there that are so concerned about these women, why hasn't there been someone who's formed a group to help locally help these women out when they're in need instead of depending on the government to help? Because this will not only tie us to the Medicaid program, it's going to tie us to the federal government who has no money. And then we're going to spend money. So help me, if you can, answer that question. Thank you, Kathleen.
Go ahead, Kathleen.
Thank you, Mr. Chairman. Senator Hutchins, yes, I think women do need all the help that they can get. I love the program Climb because I think it focuses on helping women get out of those regular roles and do something different to help their lives. I belong to a church. I know we try to support each other in our church groups, and I would imagine that you do also, Senator Hutchins. We need more. I agree with you. We need more, but I think they also need women supporting each other in support groups does not allow for the need to go to the doctor, the need to go to counseling, the need to find therapy that they need outside of that support group. And I don't know if that answered your question, but I tried.
Follow up, go ahead.
Thank you, Mr. Chair. Kathleen, it did kind of. What I'm talking about is the financial support for these women, not so much saying you do it, but getting together, funding, like maybe taking on a woman that you know is in need and providing for her financial, mental, healthcare needs. Thank you.
Mr. Chairman, Senator Hutchins, I think that's a great idea. I think it's wonderful if we could put that together. I don't know that, I know my church doesn't have a lot of money, and I don't know if other churches have a lot of money, and that's kind of where you get the support from. We do have funds that help intermittently, but not on a long-term basis. I think that would be a wonderful thing for our churches and our organizations to take on. But I don't think they're in place yet to carry that financial burden that is required after birth of a child.
Okay, Ms. Somerville.
Thank you very much.
Thank you, Mr. Chairman, members of the committee. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. And Mr. Chairman, my comments will be very brief. Our community mental health centers strongly support this bill as an additional access to care for mental health care. We think it's important that women are able to access mental health care and certainly physical health care at the point in which they feel most comfortable. And oftentimes, as you've heard in testimony before, that visit is going to be at a postpartum piece, or maybe they're going in for a visit for a pediatric visit for the baby, and we want to make sure that they have that access. I also just want to remind the committee of the importance of treating both mental health and physical health. We know that if you're only receiving mental health care, but you have physical ailments, maybe it's diabetes, maybe it's something else that's not being treated, that physical condition that's not being treated will probably negatively impact your mental health. And it goes the other way as well. If you're only treating the physical side but not the mental health problem, then that will impact the other side. And so we think it's incredibly important. As we had, the committee has had a little discussion this morning, the community mental health centers are certainly there as a resource to step in for the mental health side of things. I would remind this committee that eligibility is changing, July 1 of 2024. And certainly postpartum women are not a tier 1 priority category. And so I think that it's important that we continue to improve mental health access across the state, realizing with the new missions of the community mental health centers that we won't be able to serve everybody. Mr. Chairman, with that, I would stand for questions.
Questions from Ms. Somerville? See none. Thank you very much. Doctor, go ahead.
Thank you, Chairman. Hi, I'm Dr. Renee Hinkle. I'm an OBGYN physician here in Cheyenne for 24 years. And I am in support of this bill. We've heard a lot this morning about the mental health portions that this bill would help with, and it is a fairly common problem after delivery. But there are many other issues that go along with postpartum care. And I truly believe that this is not just about treating the mom. It's not just about getting the mom through a certain portion, although that's what this bill will do. It's actually about helping the babies. It's, we want healthy babies. I mean, I know many of you are pro-life and we have the babies here. We need to take care of them. And the best way to do that is to take care of the mom so that the mom can take care of the babies. There are many things that happen for women after delivery, and not all of them are resolved within the 60 days that currently Medicaid is treating for. And so, if a mom is breastfeeding, which we all encourage our moms to do, and she gets an infection in her breast and, she's 90 days postpartum and she can't afford her medication, then the baby's not going to be nursed anymore. The patient could end up with sepsis. I mean, there are major complications that can occur. And then if she does end up going in for that care, then she'll have huge bills and then not be able to pay, for, it's a huge cycle. So they're not being able to pay for, the medicines, or they're not being able to pay for their kids' formula or their diapers, so it's a huge process. It's not just one thing. It's not just the mental health, and it's not just the physical health, it's all of it. And so complications just in routine, like I said, with breast infections, things like that. If they have to have appendicitis, if they have, their gallbladder and they can't afford any of that, then the baby will suffer from all of that as well. So taking care of the mom for this 1 year after delivery is actually taking care of the babies. And I think that's something that we need to keep that focus on. I also, to address Senator Hutchins' question about, women's groups paying for this, it's impossible to do that. This is insurance. I mean, insurance is not cheap. There's no way you can get a women's group in the state of Wyoming that would be able to cover all of the insurance for every postpartum woman in the state for a full year. So I don't think that's reasonable to expect a private group to do that. This is taking care of the women and the children of the state of Wyoming. And I think that the government is the arm that does that.
Thank you. Questions for Dr. Hinkle? Senator Hutchins.
Thank you. And I'm asking a lot of questions because I really want to know. I really do. And I don't know about the gentlemen if they've already gotten their questions answered. But Mr. Chairman, I'd like to ask Dr. Hinkle, we're talking about there's not enough money out there from personal sources to help. How many women are we talking about? Is question number one. And then question number two, does this also care for women who've miscarried or had abortions, the aftercare of that, if you don't mind answering.
Chairman Baldwin, Senator Hutchings. I'll address the second part first. As far as I am aware, that Medicaid does not cover after a miscarriage. It doesn't cover the same postpartum care after a miscarriage. My understanding is they have to be at least second or third trimester before that would go into play. As far as the numbers go, I don't know the exact number of deliveries that we do in the state of Wyoming every year, but I know at our hospital we do about 1,100, and about 30% of those are Medicaid. And so you'd have to kind of extrapolate from there. So it's a pretty good number.
Okay, so here's a plan. Before we go to the next two, and thank you very much. We appreciate you coming in. We're down to about 10 minutes before we're going to close this to public testimony. So you're each going to get 2 minutes. So nobody else filled the other chairs. So it means nobody else is sitting here really wanted to come up. We'll get your two, and then I'm going to ask something online. If we can have anybody that's online that's in opposition to the bill to please raise their hand. So let's go ahead, Ms. Decklever.
Thank you, Mr. Chairman. Members of the committee, Tony Decklever with the Wyoming Nurses Association. Very briefly, for all the reasons already stated, the Nurses Association does support this bill. For Medicaid is for poor and that was brought up earlier. In my own personal business here in Cheyenne, I see many young mothers, and they come to me for a service, but they're struggling, and they can be and they're working. In many cases, they're working in childcare. They're working with the DD population. They're caregivers, but they don't have insurance. And postpartum things that can happen, yes, but there are other things. And I've visited with some of these women that they have other healthcare issues. And when I ask them, have you seen somebody? Their comment to me is, I can't afford it. I am already paying for childcare. I am already paying for rent. I am already paying for all these other things. And I'm working, but I'm working at a job that does not provide insurance. And I just don't have enough money to pay for healthcare. So because other things are a priority. As nurses, we're all about prevention. And we know that if you address something early, that it is much cheaper than to wait until it's catastrophic and they end up in the emergency room for any reason, whether it's another disease or an ailment or whatever's going on. And so that's why we stand in support of, because if we can take care of these people, they actually are cheaper in the long run than if we have to take care of them on the other end when they are very sick or very hurt. So I'm standing for any questions.
Very good. Questions for Ms. Decklever? Seeing none.
Thank you.
Thank you very much. Sir. Everybody ran away.
Mr. Chairman and committee members, my name is Brendan McKinney, and I hope to grow up and be like these other speakers, as skilled and artfully communicating as they have. I agree with all of it, of course. My daughter's back there and shared her heart and soul and her passion for the children and the families. One of the things she mentioned to me the other day was the impact that it has on the fathers. And fathers maybe traveling for their work, maybe not available, maybe not even around. So they may be very alone, and so the domino effect affects the whole family, including grandpas and grandmas who may not be there. In Wyoming, there's a lot of isolation out there where families may not be right there handy to help out. But I think my main message would be, we have this image in Wyoming, and it's a fake image, that we're so tough and we can handle everything and pull ourselves up by our bootstraps and blah, blah, blah. And yeah, look at our suicide rate, look at our alcoholism rate. This is just a total fabrication. It's a phony image. We suffer as much and as anybody else, and maybe more apparently, with the kind of rates, suicide rates and stuff that we have. But wouldn't it be a great thing to have Wyoming have the image of, We want our families and our kids to be cared for and to go get help. Wouldn't it be great if we were the leaders in the nation of saying, we want to invest on our children and our families? Wouldn't that be exciting? And Mr. New Dad, if you're having depression and you get some help, that we all do this, wouldn't it be a great image of Wyoming instead of this phony thing? Well, just pull yourself up over your bootstraps. And insurance, I mean, it's just silly to think that there's going to be a group out there that's going to raise money to pay for one postpartum gallbladder surgery. And if that was true, why don't we do it for everybody? Why don't we all just forget the whole federal government, Medicare, and just do that? But beyond that, I really think, I want to stress, why not we have the go-get-emness to really promote and educate and advocate for people to get help. And Mr. Chairman, thank you very much. You've been very considerate. Thank you.
Thank you very much. I think you could have been a good football coach. Okay, did we get any hands raised online?
I don't see any hands up in opposition to the bill.
Is there anybody in the room that's in opposition to the bill? I don't want to miss this opportunity if you want to speak. Seeing none, let's go ahead and close the public comment. And let's go ahead. Committee, what's your pleasure? Bill. House was to cut the appropriation. There was a sole amendment in there.
Do you want to address that amendment first and then just have a thought before we vote?
Go ahead.
Are you looking to increase, or what are you thinking, Mr. Chairman?
And just my own personal feeling, I think we leave it where it's at.
Agreed.
Yeah. Do you agree on that?
Mr. Chairman, I appreciate those who took the time to testify today. And I was watching this come through the ranks, trying to make some decisions. I know of people who've received help because they financially have been able to, but I also know people who did not receive that help. And we can say, oh, there are groups out there that will do it. It doesn't work that smooth. It doesn't work that well. We have a segment of our population that could use some assistance here. The mom and the baby, that really drove that point home, and that's why I asked for further testimony to be emailed to me. Both are affected by this, and I would say that there are probably times that there's a time and place for everything. There's a time to be fiscally cold and conservative and say, no, we don't do this, and look, I can go home and say I saved money. And there's a time to look after the well-being of a mother and a newborn child, and so I'll be on it for the bill.
Thank you. Further comments, committee? I would just add the comment is there's a recurring theme this year, and we've heard it in this committee, and we've heard it in other committees, of taking care of the family unit. Not just mom, not just baby, but taking care of the family unit. And I think this bill fits pretty well into that. And we're not just taking care of mom in the postpartum term, we're taking care of that baby down the road. And I think that's important. At least I am very interested in the total health care of the family. And the last gentleman spoke to us about the father's health, the father's mental health, and I think that's important. And for those reasons, I'll be an eye on the bill. Any further discussion, committee? Senator Hutchins, go ahead.
Thank you, Mr. Chair. Again, you guys know how I feel, and it's not so much that I'm cold-hearted and I don't feel for women and I don't feel for children. I was raised by a single mom who did her best before I was 4 to get off welfare. And I appreciate her tenacity in which she showed her children that I'm not going to depend on the federal government for anything. I'm going to raise my children the best I can by getting out, getting an education, and getting a job. So that's inbred in me. That's something I saw every day. So I'm not cold-hearted. It's just I ran on not entangling myself or our state with the federal government in any way if I can at all help that. So I'm going to be a no because this is another program where we're gonna spend millions getting ourselves tied up with the federal government, not knowing what strings are gonna be attached for the future. So that's just my personal opinion, and I appreciate your time. Thank you, Mr. Chair.
Thank you, Senator Hutchings. We appreciate your heart and we understand it's not cold. We appreciate your honesty. Okay, with that in mind, no further comments, let's take roll.
Thank you, Mr. Chair. House Bill 4, Medicaid 12-month postpartum coverage. Senator Barlow.
Aye.
Senator Bouchard.
Absent, excused.
Senator Dockstader.
Aye.
Senator Hutchings.
No.
Chairman Baldwin.
Aye.
Sir, we have 3 ayes, 1 no, and 1 excuse.
House Bill 4 has passed our committee. I take this opportunity to thank everyone in the room. We've seen you all many times this year, and we appreciate it. This is the last committee meeting of this session. So thank you for your good spirit. I appreciate that you didn't have your cell phones turned on, although I don't need to gain any more weight with donuts. But thank you very much for all your comments and everything you've done, particularly the departments and everyone. And Monday, we're having our interim meeting, or not our interim meeting, but our discussion of interim topics. So if you haven't submitted anything and wish to submit them, get them in. We'll be discussing that Monday morning at 8 o'clock, this room. Thank you very much and have a great day. Stay